Tonight, CBS News has learned the CDC is preparing to issue an alert to doctors nationwide about a mysterious new illness tied to coronavirus. More than 180 cases have now been reported in 17 states and Washington, D.C., and there are concerns there may be more that have not been diagnosed. CBS's Jericka Duncan is in New York, where 3 children have died from the disease. Jericka?
Well, Margaret, health officials here in New York say that the number of children affected by this rare illness has now nearly doubled in 1 week. The CDC is now asking doctors to report cases of pediatric multisystem inflammatory syndrome. It's a way of getting a handle on this new illness nationwide.
Collating information and giving us guidance is key.
Dr. George Euphoria Manfo is chief of pediatric critical care at Mount Sinai in New York.
Fever, abdominal pain, and rash seem to be the presenting symptoms.
What can you tell parents to reassure them that this isn't going to explode the same way that coronavirus did?
While it is a very serious illness, it is also very rare.
Across the country, nearly 200 children are suspected of having the mysterious illness. 87% of the cases in New York tested positive for either the virus or for antibodies, which indicates past infection. While the chances of your child getting the inflammatory syndrome are rare, no parent wants to watch this.
The way she was breathing, it was hard. Just wanted to be next to her.
Shivali Rodriguez's 3-year-old daughter, Alani, was exposed to COVID. Her mother tested positive in March. Alani had a fever, was dehydrated, and had low blood pressure. She was treated with IV fluids for 4 days in the ICU at a hospital in New Jersey. Alani is thankfully back home, doing what she loves, dancing. Doctors say it's important to note that even as we've seen more of these cases in the last week, most of these inflammatory syndrome cases, Margaret, are treatable.
Thank God for that. Jericka, thank you.